opening the door to a new era in diagnostic imaging. Queensland X-Ray is proud to launch the first 64-slice PET-CT scanner in Queensland, the GE Healthcare Discovery 690 PET-CT scanner. This breakthrough technology is the first of these scanners to be used in Australia and one of only 5 being used clinically worldwide. The scanner is housed at Queensland X-Ray's new facility at Brisbane's Mater Medical Centre. The centre has been purpose-built to maximise patient comfort and safety. Queensland X-Ray's leading PET radiologist, Dr Dennis Gribben, was trained in Australia's pioneering PET centre, the Peter MacCallum Centre, and believes this scanner is Australia's most advanced.
This is a PET-CT scanner, which is a hybrid diagnostic unit which uses both PET, a nuclear medicine study, to look at physiological imaging, and a CT scanner to look at anatomy. It's different. It's a new modality. PET has been around for quite some time and CT obviously has. It's the combination of the two modalities which is new, and it's given us an extremely powerful tool for the detection of malignancy. It's really the way of the future. The scanner works in that patients are injected with a radioactive form of glucose which distributes through the body, and the glucose distributes in such a way that it's taken up by malignancies, and these can be seen on a PET scan. These images are superimposed on a diagnostic CT so we can determine exactly where the disease is in the body, which helps in staging disease, detecting disease, and determining the efficacy of management.
Upon welcoming the patient to the centre, one of Queensland's X-Rays technologists will take the patient through for their scan. Initially, the patient will receive an intravenous injection of radioactive glucose, also referred to as a tracer. After this injection, the patient has to rest for up to 90 minutes to allow the tracer to circulate through their body and be taken up by the tissues. In particular, the tracer we use is taken up by abnormal or diseased tissues. The patient will then have their scan. The tracer emits radiation which is detected by the PET scanner. This provides a physiological map of the distribution of these tracers within the body and indicates any disease. A CT scan is performed immediately following the PET scan as part of the same study and is co-registered with the PET scan to provide a detailed anatomical map. The whole appointment can take up to 3 hours, with the scan time averaging around 20 minutes. Throughout the appointment, patient contact with staff is kept to a minimum for radiation safety. However, the patient is constantly monitored by audio and video in all areas. Dr Paul Mannering is an oncologist with the Haematology Oncology Clinics of Australia. This scanner is revolutionising diagnosis, monitoring and treatment planning for his patients.
So we're very excited in Queensland to be able to make use of this new technology, which will increase the sensitivity of our ability to detect cancer. What that means for the individual patient is now we can see cancers down to tiny little sizes. We saw a lady the other day who had a 5mm recurrence of her breast cancer. We were able to pick that up using this new technology, confirm it using histology, which is taking a biopsy, and therefore have saved her all the grief and problems of waiting for the cancer to grow and presenting a challenge in the future. What we've seen over the last several years is that this kind of technology allows us to more accurately predict the extent of cancers, more accurately predict how well the patient is responding to treatment, to pick up recurrence earlier and therefore intervene earlier and improve patients' chances of both living longer and living with a better quality of life. The latest PET-CT scanner to become available in Queensland represents an important evolutionary step in this technology. The improvements in sensitivity will allow us to detect cancers earlier and at lower volumes. It allows us to improve our ability to monitor response to treatment and in the future, hopefully guide targeted therapies.
The PET-CT unit offers practitioners some key advantages when planning their patient management. Some of the key benefits of 64-slice PET-CT include fused 3D PET-CT images with multiplanar reconstruction, one examination and one report combining PET and contrast-enhanced 64-slice CT findings, faster image acquisition and shorter average scan time, 15 minutes versus 40 to 60 minutes with standard PET. Superior lesion detection, localisation and characterisation due to near-perfect anatomical functional registration. Improved distinction between physiological and pathological uptake. Variable image data set options defining treatment contour maps for radiation therapy planning. And time-of-flight technology, a superior method of image acquisition and presentation, resulting in increased image quality. Key applications of 64-slice PET-CT in oncology include reliable detection of malignancy before gross anatomical changes become apparent, improved tumour detection in regions where normal anatomy is distorted as a result of necrosis or scarring after treatment, whole body imaging to assist in staging workups, and advanced monitoring of tumour response to treatment. Key applications of 64-slice PET-CT in neurology include determining the extent and severity of Alzheimer's disease, including detecting early disease before clinical signs progress and structural changes are present, differentiation of dementia types to aid in determining treatment, detecting seizure foci in epilepsy, and characterisation of certain CNS tumours. The installation of this breakthrough technology at Brisbane's Mater Medical Centre is revolutionising diagnosis and treatment by offering dramatic improvements in clinically relevant information. Queensland X-Ray is proud to offer this breakthrough technology as part of its commitment to excellence in medical imaging and patient care.